Howdy everyone, Matt here. I got a question for you. When you see a patient and they talk about their previous physical therapy experiences and they say, we didn't do anything in there. They just threw a hot pack on me and then just set me out the door and that was it. What kind of thoughts do you have? Do you think, oh my gosh, they don't know what they're doing over there. They are doing the incorrect thing. Or maybe do you think something else? Let's talk about that. But first and foremost, let me introduce myself. My name is Matt. I'm Matt the PT, and I'm coming at you with another video on another topic of something in the physical therapy world. Second of all, thank you so much for taking time out of your day to tune into the video. Thank you for the likes, the comments, and the subscriptions. And if you feel so inclined, hit the subscribe button down below. It doesn't cost you a copay or anything. So, talking about patients, and specifically when they speak, I'm going to say, not well of a previous therapy experience. What do you take away from that? I know my view has changed over the years. I know early on in my career, and for many, many years, I had a view of when patients spoke poorly of another clinic and they said, yeah, I did therapy over there and only thing they did is threw me on the bike for a few minutes and then they just put me on a table and they just rubbed on me a little bit and then they just threw a hot pack on and that was just all we did. And no wonder I didn't get better. But as I went along, that view has changed. And realizing that, you know what? I don't think it's quite as bad as that. Now, I do see this sometimes come up when we as therapists talk about physical therapy in general. And they speak about, therapy, there's so many percentages of therapists that don't practice to, the guidelines and things like that. They don't practice up to the guidelines. But, they speak about other clinics, clinicians and clinics as well. And I kind of ask, it's like, are we just basing some of this just off of like self-reporting of what patients are saying? Patients saying, like I mentioned earlier, this place only just put me on the bike and then they threw me on a hot pack. And then that's all we did. So we have this negative thought that, oh my gosh, this clinic down the road doesn't know what they are doing with the patients. They are not doing the most up-to-date current evidence. That's old, outdated. We do the best here. But are people saying that about you and where you are and with your clinic? Are they going to another clinic and just saying, oh yeah, they just made me pull on these bands a little bit and then just told me to come back in a day or two? Like, again. And I think that's how it is. I think we need to understand that very often patients don't fully understand what is going on and they just don't remember everything that goes on in the therapy session and they don't communicate that properly. So I want to share a little bit of a story. I had a gentleman come in after a back surgery. He was an older gentleman, probably in like mid-60s or so. And he arrived a little late to the appointment, and he mentioned that he wasn't feeling very well. I said, well, okay, that's fine. Thank you. You're here. We'll at least do the evaluation, do a few things with you, give you some stuff for home, schedule you out, Because sometimes, when patients come in, but you kind of have to win them over. I get that. Let's get something going. Let's establish something, and then we're going to do way more as we go along. So, evaluating, and I happened to ask. I said, "Did you have any therapy after the surgery?" He goes, "Yeah." I only went in for like 2 days. They only had me come in 2 days. I just lifted a couple little weights, and that was it. And that's all I ever did. Okay, I documented all that. Well, we did a few exercises, and just in chit-chatting with him, he said something really interesting. He was talking about horses. And he goes, yeah, he apparently dealt in horses. And I mentioned, my grandfather used to do that. He goes, oh, and he asked him his name, and I told him his name, and he goes, oh, I think I did some business with him not too long ago. I said, well, that's really interesting because he passed away over 30 years ago. And you can see this guy was like, oh, okay, I guess it wasn't him. So I kind of thought that was a little strange or just whatever. Maybe this guy's just trying to connect with me over something, or maybe just not paying attention to who he was dealing with. But anyway, sent him on his way, scheduled him all out. We thought, oh, everything's good. Well, later that afternoon, I get a call from the physician's assistant. And she asks us, did so-and-so come in there today? So, yes, we're going to fax over his eval here in just a little bit once I finish it up. He goes, well, he said he came in there and y'all didn't do anything with him. and he's upset about it. And I went, whoa. He came in. One, he was a little late. And two, he wasn't feeling very well. We let him know, hey, we're kind of short on time. I know you're not feeling well. We're going to do a little bit with you. We're going to do more as we go along. She goes, oh, okay. And I said, well, I also got a question. I said, did he actually do therapy after the surgery and prior for coming in here? She goes, yeah. I said, oh, well, he only told me he did 2 sessions of therapy in this entire time. That's all that he ever did. And she goes, what? He did 6 weeks of it, 3 days a week. I went, oh, okay. Just wanted to confirm that. So we went along, and a day or two later, the gentleman came back in, and tell you, boy, he was doing really, really well. And I mean, did everything I asked him that we wanted him to do. And then after that, he didn't return on that. So I know that's kind of an extreme case, but that kind of brings it up. Like he did not accurately, communicate what he had actually done. He had done a very long round of therapy multiple times a week and actually did quite a bit in the therapy sessions, but didn't communicate that over to me. And then likewise, did not communicate that accurately to someone else. And this just goes to show, like, okay, why do people do that? And I think there's a couple reasons. One, something was up with this guy. Okay. There was a reason, like, again, the thing about my grandfather and talking about that was a little out there, and to kind of catch somebody in not being truthful, as we'll say, about that, which was very strange. But, like I said, my thought about this, about other therapists, have changed. And I know there's there's that research out there that says there's a high number, percentage of therapists out there that don't practice to the basic guidelines of things. And we think like, oh, these patients, these therapists over here, they just throw people on hot packs. And these people over here, they're just pulling on the yellow bands and they're not doing anything. And because are we just self-reporting that based upon what people say? And I often think that there's a lot that goes in that we really, really need to understand. Because if you start talking to all these therapists, the way that they communicate, that they're doing the most, up-to-date, current, best evidence, that they're getting people moving, then there are people getting exercise, and they're getting feedback from patients, and they're doing really, really well with it. But coming from the patients is a little different. And like I said, I think it's a couple things that we need to keep in mind. One, I do believe that, patients, they're, most of them are not medical professionals. They don't work in medicine. They do all sorts of jobs on there. So they don't have a full understanding of why we do stuff. And there is that thing, if you don't understand what someone else is doing, it's kind of hard to communicate it on it. To break down exactly what they're doing because you don't understand what is going on. So I get that. And even with like exercise and movement, I know there's a fair number of the patients I see who are not, they're not people who work out. They're not athletic. They don't play sports. They're not athletes. They do a different form of exercise. They may be doing a yoga, and we're doing resistance training stuff, so they don't understand. So how do you communicate all of what you do? Because again, I would say if you talk to somebody going to the gym, they can break down everything that they do in the gym. But if you get somebody maybe who doesn't do that, they don't understand what and why that they're doing those things. Also, look at it is that you get a lot of information when you come in. And I will say, if you spend time with me, and I know I'm very sure that all of you are doing the same thing, you're educating patients throughout the whole time that you're there. And I know many, many therapists who do this, and we love talking about how we educate people. But think about, we give people so much information when they're in there, from everything like the why about we're testing something, what we think it's going on, why we are doing this, what's the goal of doing this, and what our plan is over here, and what we're going to accomplish at over there. That's a lot. It's a lot of information to try to intake. And what is it? Can't even think about what is the the amount of information that we get per day versus what we actually retain. We don't retain everything that's going on. And think about, you're just getting dumped with so much information in 30 to 45 to 60 minutes or so. You're getting a ton of information. I also think some patients are coming in pain. you're in your pain. Are you in the best state of mind to absorb information and take that in? So, I picked up a thing here, I picked up a thing there. It's hard to try to recall all of that. And that's fairly challenging. So again, when somebody comes out of there, they may just only pick and choose a few things that they really remember. I know Adrienne Lowe talks about that. Patients remember how you made them feel and the last thing that you told them on it. So I can see that. Like maybe you did take a time when you were bending somebody's knee to assess their range of motion and you pushed them a tad bit too far. Ow, felt that pain. You apologized. I'm sorry. Oh, sorry. That's right there. We're going to measure that real quick. And what would they say about that? Oh my gosh, you just pushed my knee all the way in. But did they talk about the 30 seconds that happened after that where you apologized, you got them out, you did something to help them feel better? What would be the last thing that you told them that they took into their mind when they went out as well? You told them so much stuff. You kept giving them information. Just give them all this stuff. And I don't remember the first thing you told me, and I just remember this thing over here, and I just remember that thing over there. So that's really a lot. And I'll say, I do think we do need to cut each other slack when it comes to that stuff. Just kind of based upon that. Because a couple things. Again, patients, it's hard to take in all that information. There's a lot going on. You're getting a lot. You're not feeling good. Oh, this is not your forte. And there's also a percentage of people like the gentleman I dealt with earlier, for whatever reason, that was just kind of making up stuff, or maybe patients have another agenda. There could be a secondary gain or something like that. They may be trying to kind of pit people against one another. So they're trying to, maybe twist your words and stuff like that. But like I said, I think we need to cut each other some slack. And I think we really need to do it with one another to understand that we're all on the same team. We're all therapists. We're all trying to do the best that we can. We don't know the situation that was going on with that patient over at that clinic over there. Maybe they were in a really inflamed state. Maybe they were just really angry. Maybe just something was going on, and that therapist is like, look, I want to do this, but we can't get to that because you're too painful. You're this, or there's a reason. Let's just do this, and I can build you up over to doing this. It could be those things in it. I also think, and I'll drop a couple of these things in, that kind of bother me when it talks about this. And there's like three groups of people. One, management. So the managers of PT, rehab facilities like that. I will say I've had some good ones and I've had some poor ones. And there have been times when patients put in complaints about me, about something I did or said or something like that. And I'm going to tell you, the good ones came to me and they said, Matt, I want to hear your side of this. I want to talk about this. And they listened to me and they said, oh, okay, I could see that was possibly a misunderstanding. I've had a few poor managers that never talked to me on it, that took that poor, the way that this person had communicated and told them about me, and they believed every bit of it, despite the fact that there have been probably literally hundreds of other interactions that no one had ever said anything, and they automatically believed this over here. And even the managers seeing me, being in the clinic to see me, and they just automatically believe that. And it puts a tarnish on it. I also believe it comes down to things like case managers and adjusters and physicians. And I really, really wonder why. And I want to know, if you're in a case manager, adjuster, or physician watching this, please let me know. Why do you automatically believe if a patient speaks poorly of a therapist? It's just kind of this. If it's just a one-off thing, that they speak poorly of it. And I've had that happen several times over the years, that a patient spoke poorly to me about me to a case manager, an adjuster, a physician, and we get this angry call over it. And it's like, wait a minute. You didn't call to talk to me about this, to get about the situation on it. And if the roles were reversed, and I'm bringing this up, if the roles were reversed and I was calling you with what this person said, these things about you, you would be saying, they're not telling the truth. Here's what actually happened. And I think we need to take that in consideration to say, let's pull back a little bit. Could we reach out and talk to this person to say, hey, what's going on? Maybe there's a misunderstanding. Maybe there's a miscommunication. Maybe it was just taken at the wrong the way. You can just think about it. If you're in a different state of mind, how that you're going to intake stuff. If you're in a good state of mind, somebody says something, you may take it positively. But if you're upset, or you're angry, you're feeling well, somebody can say it the same way, same tone, and you could be taken completely different. But with all that being said, I want to say, I really do think that we need to cut each other some slack. Give each other the benefit of the doubt. We are all good therapists. I have rarely met a poor therapist. The therapist that was not doing the right thing for their patient. I'm not going to say none, because like I said, I have dealt with them. I have dealt with therapists who are poor. But statistically, that's just going to be in anything. In any profession thing. You're going to have people who are not going to do the right thing, but they're usually few and far between. But I'm going to say, I know that you are a good therapist, and that the therapists that are your neighbors and your colleagues, they do well. We all have our strengths. We all have our weaknesses. And let's cut each other slack. To say, no, I know my colleague is doing the right thing. Now, I will say, if it comes in become a pattern of something, maybe that's probably a problem. If we're getting the same thing being said over and over again, probably an issue in there. But cut each other slack. We're all on the same team. We're all looking to help. And I don't want to blame the patient. I'm not blaming patients to say that this, but understand, there could be a lot. There's a misunderstanding. They're in a different state of mind. They're painful. They're angry at somebody or a system or something like that. And that's how they just want to portray it. But I'm going to let you know, I'm not going to throw any of y'all under the bus. And that's how I look at it. I don't want to put any of my colleagues down, anyone else in this profession that we do, this wonderful profession that we do. I don't want to put y'all down. I don't want to put any physician down or chiropractor or massager. Anyway, you're trying to do your best to help patients and doing it. We're all going to be different. People are going to respond differently. So, if you enjoyed the video, I would please ask you to hit that like button, consider subscribing to the channel. And of course, as always, I want to hear your comments. I want to hear your beliefs. Have you had this interaction? Has somebody talked bad about you? And then somebody communicated to say, hey, that doesn't sound like you. And what have you done about it? I want to hear those things like that. And because I do think it's very important that we share it and that we talk about those things, then we can have a much better understanding. And with that being all said, I will leave you with this. Take care of yourself. Take care of your patients. I will see you all next time.